Hi, my name's Will. I'm one of the trainee specialist critical care paramedics here with Cornwall Air Ambulance. I thought what I'd do quickly is just give you a rundown of our primary and secondary bags that we carry both on the aircraft and on the car. So this red one, this is our primary bag that we carry. These bags always come to Seamless for every patient, and in this bag it's mainly to do with airway stuff. Top one, easy grab, we've got suction units and some basic airway adjuncts at the top, and in the bottom bag, equally as easy to grab, we've got a selection of masks for delivering oxygen to both adults and paediatrics, and also some what we call BVMs or bag valve masks for delivering oxygen whilst we ventilate patients like that. The bag within the bag on the inside, really useful. Then everything you need for protecting someone's airway and being able to deliver oxygen is right here. And when we're delivering anaesthetics to patients or we're helping with patients in cardiac arrest, we use this airway board, and everything that is needed, including some kind of resilience pieces in case something goes wrong, is all here on that board. Everything else in here, we have our rescue airway devices and some really specialist bits of kit. For example, in this pouch we carry a video laryngoscope. Previously we'd be using direct laryngoscopy, and we still do that sometimes, but in most of the cases we now use a video laryngoscope, which has really improved our airway management. We have a pelvic binder for patients who need kind of splinting and hemorrhage control, as well as the full hemorrhage control bag that contains things like specialist bandages and tourniquets. Also, we have the IO bag. IO stands for intraosseous, and this is just when we're trying to get access to a patient's circulatory system, but we're not able to get access to their veins. In here is where we mainly carry our drugs. So in the top of the pouches we carry drugs that we use for patients who are really sick, so patients in cardiac arrest or those that we need to be putting to sleep with a pre-hospital emergency anaesthesia. Here, this is our spares bag, and everything's tagged up and ready to go, so if we need to grab something quickly between jobs we can. We have some specialist fluids, so we're able to deliver medications to patients who are in kind of a specialist subgroup there. And part of the specialist fluids that we give is one of the really important ones is blood. And two of these pouches here are dedicated to the delivery of blood to patients. So with blood you have to give it through a fluid warmer. So we have a battery pack and fluid warmer set in here, as well as all the associated cabling and kind of cannulae and everything that's needed to deliver that blood to those patients, and that's really important. So we have what's called a Kendrick traction device in here as well, which helps people who might have had an injured leg in one way or another. And then just some other kind of consumables that we have. This is the drug admin's consumables, and also some resilience stuff built in so that we have spares to play with if necessary.